be performing a test to see exercise-induced asthma. Today we have Bridget as our demo, and we're going to be doing 85% of her heart rate max. We took her FEV1 before exercise, which was 3.33. We're going to have her warm up as she's doing right now. Once she's warmed up, we're going to have her perform 10 minutes on the treadmill at 85% of her heart rate max. From there, we're going to test her FEV1 again, and we're going to see where she's at. If she's at a decrease of 15% or more, that indicates exercise-induced asthma. We selected the protocol of 10 minutes at 85% of our heart rate max based on an article from the New England Journal of Medicine on preventing bronchoconstriction in exercise-induced asthma with inhaled heparin.
So now we are going to increase Bridget's speed and incline just a little bit so we can get her heart rate up to 85% of her heart rate max. Just to talk a little bit about asthma today, doctors usually start by doing a physical exam on patients who they may think that have exercise-induced asthma, which includes your ears, nose, throat, and they may also ask a series of questions. They also like to rule out certain conditions, such as if the client is out of shape, if they have heart disease or any heart failure, any lung disorders, side effects of certain medications, central airway obstruction, vocal cord dysfunction, and any other allergies. And sometimes they will just try to inhale before exercise, kind of like what we're doing, do a test like this. Other tests that include to test exercise-induced asthma may be spirometry, which measures how well you breathe, and which is what we are doing today here. And also we have the peak flow measurement. And in this test we use a peak flow meter, which is a handheld device, and which measures how fast you can force air out of your lungs. The slower you exhale, the worse your asthma may be. And the patient is asked to use the meter at certain times, such as before and after exercise. Another test that is used is the nitric oxide test, and this is used to see how much nitric oxide gas is in your breath, and the high levels of nitric oxide equals asthma. And next we have the methacholine challenge, and this is when you inhale a small amount of methacholine mist to see if it causes asthma symptoms. And finally, we have the allergy skin test, and this just tests your allergies and can also lead to asthma as well.
Bridget's been on the treadmill now for a total of 12 minutes, including her warm-up. We're going to bring her to a cool down, and then we're going to test her FEV1 again and compare it to her original before exercise FEV1.
And Bridget's current heart rate right now is 166, which is 85% of her heart rate max.
Bridget, when you feel cool down, go ahead and bring your speed all the way up. Now we'll go ahead and test her FEV1 again.
After taking Bridget's FEV1, her after exercise was 2.83, which definitely indicates that she does have exercise-induced asthma because it is 15% lower than her FEV before exercise, which was 3.33.